Hi, everyone. Welcome. Good afternoon. We're going to go ahead and get started. Thank you for joining us today. My name is Karen Bell, and I'm an Associate Director for Partners for Advancing Health Equity, or the P4HE Collaborative for short. We are based at the Tulane School of Public Health and Tropical Medicine, and we are sponsored by the Robert Wood Johnson Foundation. We are a national research learning collaborative that aims to bring together various sectors that are working on health equity. These include government, academia, community-based organizations, philanthropy, and the private sector. Here at P4HE, we convene these sectors to work together to better understand critical issues related to attaining health equity. One of the ways we do this is by providing spaces for activities to engage with these groups in insightful conversations on timely topics and promote actionable solutions. Recent events and crises, such as the COVID-19 pandemic, police killings, wars, and human exploitation across the globe, discriminatory policy changes, and visible and viscerally experienced effects of climate change have increased mental health issues, especially for marginalized groups. People and organizations committed to health equity must prioritize mental health in addition to addressing these crises. Such responses to mental health must center the needs and voices of those experiencing the most harm to develop interventions and effectively address mental health, well-being, and equity. Today, speakers will share their insights on how to respond to critical mental health issues during crises. Speakers will discuss ways that communities, researchers, and organizations can collaborate to address mental health in pursuit of health equity. So, as you all know, if you've been here before, we like to start by hearing from you. You all have valuable opinions and insights on health equity, and we want those to drive today's conversation. We will be using Mentimeter, which you can access by scanning the QR code on your screen or by going to www.menti.com on your browser or mobile device and entering the code 82738950. So I'm going to go ahead and do that while you are doing the same. Either scan the code on your screen or go to menti.com and type in that code 82738950. Okay, you hit join and it should add you in. You can do a thumbs up to let us know that you are there. All right, just give people a few more seconds to join in. Okay, and once we're ready, a question should appear on the screen. Okay. Thinking about you or your organization, what policy or practice changes can you support to address mental health given these current crises? So take some time to think about this. You can actually put in multiple responses. So if you think of something and then think of another thing, go ahead and add it. That's totally fine. All right, I will do the same. All right. Okay. All right, so some of us are thinking along the same lines. Paid leave, mental health days, time off for mental health needs, and developing better support for our interns and fellows. So speaking specifically about your organization, great. That's sort of the point of asking the question in that way, is to identify ways specifically for your organization or wherever you work. Designing healing-centered processes and integrating a healing-centered approach into design processes. Okay. Acknowledge what's happening. Yes. By making sure individuals get the information and resources they need. Yeah, we should definitely have better systems, better access to mental health providers, perhaps having some available for employees. So literally having the mental health services there at the job or even at schools. How to prioritize work, mental health check-ins like that. address not only child mental health in early learning settings, but also that of the adults in those settings. So yeah, all of us, no matter the age, are living through these crises, but children might process things differently than adults, and adults different from children. And so we need to acknowledge and work toward that. Okay. Having key staff trained in mental health first aid to support both employees and clients and third parties in their mental health journey for early identification. So I like that, thinking about both the employees, the clients, as well as other individuals or organizations that you're working with. Flexible calendars and schedules. Yeah, we definitely need that. Access to physical and mental health resources and care. Thank you for bringing up the physical and mental health resources, how they are probably linked as well, and mental health training, supporting each other's differences. Yeah, we often deal with these things differently. Happy hours for the office. All right, we are in New Orleans. We can definitely see that happening. Calming corner. Yeah, so more design, or excuse me, censoring mental health in our design of our offices, or even just our spaces or context. Mental health should be provided for everyone and covered as a basic need by insurance, whether it is telehealth or in person. Yes. And support groups. Yes. Having a trauma responsive approach and treating others with compassion and curiosity about what people may be experiencing. Thank you for using that word, trauma responsive. Yes. And continue to be considered myself, that we could all be going through a mental health issue on any day. Yes, that's an old adage that we all should follow. You never know what people are going through. And different crises can impact different individuals or groups differently. Thank you all so much for your responses. And, our panel is seeing this and is able to potentially respond to some of the things that you all said. As always, we really appreciate you all for providing your input. We're always excited to have you here collaborating with us to take action for health equity. And please continue to share your thoughts and comments in the chat throughout today's discussion. You can also join this conversation with your questions and comments beyond this webinar on Twitter by using the hashtag partners4HE. Okay, so I'm going to introduce our panel. We have a distinguished panel, and I'm going to start off by introducing Dr. Raquel Martin, who is a clinical psychologist and professor at Tennessee State University. Dr. Martin, hello.
Hi, how are you doing?
Good, thank you. Thank you for being here. Next, we have Leslie Nolan, who is the Behavioral Health Director at Imperial Calcasieu Human Services Authority. Hi, Leslie.
Hi, how are you?
Good, good. Thank you. Thank you for being here. And next, we have Brett Ford, who is the Effective Science and Health Laboratory Director at the University of Toronto. Hi, Brett.
Hi, thanks so much for having me.
Good. Thank you for being here. Thank you all for joining us. I will say that when we thought of doing this panel, I was just thinking about how we have to go to work the next day and have to deal with regular life when so many things are happening, right? Actually, we're going to talk about our podcast in a minute or toward the end of the webinar, but we did a podcast recording with a researcher in Chicago who looks at youth with ADHD, but was talking about community violence. And we actually had just had a mass shooting here in New Orleans and then had to go and record this podcast about community violence. And I was just like, hey, real life is happening all the time. And we have to just keep on going like everything is normal and we need to deal with this. So to be honest, we wanted to do this webinar to hold space for all of us because we're real people dealing with real life. And for me, this is just a way to acknowledge that these crises are affecting our mental health and we need to talk about this. And they're ongoing and compounding. Leslie will talk to you about like hurricanes and climate. It's raining here in New Orleans. That's like an actual hazard sometimes for us and can cause stress. So anyway, I just wanted to set the sort of set the scene or set the table by acknowledging why we wanted to do this. And for each of you all have your own expertise, but also your own experiences. And so I just wanted to ask you all, what mental health challenges are experienced during times of crises, and also thinking about your particular expertise. What would you have to describe there? And actually, I didn't think of the order, but Dr. Martin, if you want to go ahead.
Yeah, so I would say that one of the first things that happens is that individuals, their activities of daily living will fall off. And for anyone who's wondering what are activities of daily living, they're anything that you need to keep you going every single day. That's personal hygiene, that's showering, that's brushing your teeth, that's washing your hair, that's with your environment, that's doing dishes, that is cooking food, that is fulfilling for your body, that is washing clothes. I would say that's one of the first things that will fall off. And I think that's understandable. Most of the time I provide recommendations of individuals to get them to where they need to be. For example, one of my patients consistently had difficulties like loading the dishwasher. And I said, do you know that you can, those little baskets for utensils, you can buy a spare one. So put a spare one on the counter and load that up, and then keep the other one in there, and then just rotate it, just fill it out. If you have difficulty with dishes, get paper plates. I totally understand the environment, but I also understand that we're worried about you in this moment. You had difficulty washing your hair, get some dry shampoo. You don't have the energy to do your hair, because I had a patient who was physically tough for them to just keep their heads above their head because they were just so exhausted. Put on a head wrap, try a protective hairstyle, right? If your dishes are getting too full in your room, and get one of those little bins, right? Like, I understand that this isn't going to work for the rest of your life, but the goal is to provide you with the environment that you deserve, and you deserve a clean environment. You deserve food that sustains you. You deserve things like that. So that's the first thing that falls off. I'm going to provide you with some tangible exercises to get you there, so that you're like, okay, well, actually today it wasn't as exhausting for me to do things because I didn't feel so overwhelmed with my messy room. Why? Because I got another hamper and I put a dish bin outside my room and I didn't feel so overwhelmed. So I was actually able to go outside, right? So I tell people, there's branch work and there's root work. Root work is, of course, we're going to get to the intricacies of what's driving the depression, but sometimes you need that branch work to kind of just get you up and out the door. Like, yes, I want to talk about what, of course, you want to talk about what happened with your parents. But right now, you can't even think about surviving the next minute. So branch work is also important. We want to get to the roots in mental health, but I also want you to feel comfortable with how you're feeling. Realize that it's okay, and realize that you're deserving of these things. You're deserving of nutritious food. You're deserving of having a clean workspace, and it's not always going to be fun, because self-care and caring for yourself is very rarely fun. It's in no way sexy. It's like tube socks and high cut briefs, right? Like, it's there to support you, like to get you where you need to go, right? So it's not always going to be fun. It's not fun for me plugging my phone up across the wall when I really want to doom scroll all night and look at videos. It's not fun for me to budget when I really want to walk in Target and like let it tell me what I need for that day. But that's financial self-care. That's, emotional and physical self-care. Vegetables, I mean, they're fun some of the time, but not all of the time. But like, that's physical self-care. So activities of daily living fall off all the time. And I tell my patients the same thing I tell my children: just because you don't want to do it doesn't mean that just because it's difficult doesn't mean you get to opt out of it, right? Like, it just means you do the things you have to do the things that you want to do. And trying to find a balance between, for everything that sucks, let's find like 2 things that you like. But you do have to do the thing that sucks a bit. Like, as long as that's understood, let's get that ratio going.
Thank you for the practical advice, as well as acknowledging that Target is a coping mechanism.
No, and that's what you heard. That's not what I said at all. What I said,
yes.
what I said was a good financial self-care. Because some people they'll think it's indulgent, like, oh, the spa, and that could be very helpful. But financial self-care is budgeting. Emotional self-care is expressing yourself. Social self-care is stating that, like, there's not always going to be times where you're going to be receptive to being the best friend, and acknowledging that instead of ghosting people, right? Like, yes, spa days and manicures are amazing, but a lot of self-care is not, it's not hot. That's just what it is. Like, I tell my younger patients, like, no, it's not going to be hot, honey. No. Mm-mm. It's not fun. I'm sorry. But I need you to take care of yourself. But I do think a lot of people use Target as a coping skill, but there's nothing worse than when you get to the end of the week and you realize you didn't need a fourth Chase Lounge, and you didn't realize that because you didn't have your financial self-care of budgeting. And now you're like, I'm stressed out and I'm mad at myself and I'm not being compassionate. And this could have been better if you just had a cash budget. I tell a lot of patients, like, take out cash. That's how much you're allowed to take into the store. You're not allowed to spend over this. Certain, like Target, certain people, I'm like, I don't want to even hear you taking your card there. And I don't even want you to take your phone because I know you have Apple Pay. Don't try to trick me. Take $40 out. That's in your Target budget. That's it. Like, you're not allowed.
Yeah, well, thank you. Thank you for clarifying that. I will take that for myself. Dr. Ford, would you be able to share some of your thoughts about this need to deal with mental health in times of crises?
Yeah, I mean, times of crisis can mean that there's something acute going on, right? Kind of short-lived maybe, but oftentimes, and certainly, Karen, what you set the stage with, these big kind of global stressors, they're not just acute. They might have kind of acute manifestations, but they're chronic issues. And we know from lots and lots of research on chronic stress just how steep the toll can be on mental health and physical health. It's all interwoven, right? So Dr. Martin mentioned, depression and some of these really important kind of downstream behavioral consequences of depression. There's also anxiety that's going to come up a lot for people, which can be really immobilizing as well. Loneliness, right? Crisis can make people feel really isolated, and maybe even withdraw, right? Like the ghosting, which feels right in the moment, but can also come with these really important downstream consequences as you become disconnected from these really important sources of social support. Not to mention that, there's so many missed opportunities for thriving and for growth that can happen, right? Life isn't just about avoiding depression, anxiety, and loneliness. It's also about, opportunities to connect and to feel well, to feel wellness, not just a lack of illness. So there's so many ways in which crises at different levels affect our mental and even our physical health, to the extent that it's all kind of interwoven.
Thank you. Leslie, do you have any opening thoughts that you want to share? Oh, I think you're muted, Leslie.
The first two very confident speakers already hit on a lot of it. I'll just piggyback a little bit. So with a little transparency, most of my career I did therapy for children and adolescents. So my lens is a little more concrete, a little bit more simplistic, but I will say that one of the things that as we've worked through different crises with children, we ask them to focus on the helpers. And I stole that from Mr. Rogers. When children are afraid, have them look for the helpers, because there's always helpers. And whether that's first responders, whether that's police officers, whether that's therapists, I think it's a wonderful reframing of, in the midst of chaos, looking for the helpers. It helps you to look for the good and something, and I've always found that to be a really comforting way to kind of look at a crisis. And agree, the anxiety is higher, the depression is higher. We get a lot more knee-jerk anger responses. I think people are very, very quick to anger when they feel like they're about to lose something that's important to them, or they can't have something they want, whether it's things to go back the way they were, they want their house back, they want their whatever back, whether it's something concrete or something a little bit more like safety and security. We want to go back to that time when we felt safe and secure, and we get angry when we don't have it. So one of my bigger takeaways is, when we are in a period of crisis, whether it's an individual crisis or community crisis, we have to extend grace to others and know that they're not operating at their best, highest level. And we probably aren't either if we're part of that community that was impacted. And more importantly, to ask for grace. I think sometimes we forget to say, could you just be patient with me because I'm having a hard time right now, and I need just a little bit of space and grace. And I think teaching our clients especially to advocate for themselves and ask for a little understanding, a little patience can go a long way for somebody getting their needs met.
Thank you. Thank you. I wanted to ask you all about how the COVID-19 pandemic has affected sort of mental health issues broadly and maybe in more detail. It's up to you, but sort of like a second question is, all of you all have particular expertise and experiences that have come up along with the COVID-19 pandemic. So I'm thinking Dr. Ford about political crises, Dr. Martin about racial justice crises, and Leslie about disasters, hurricanes and things like that. Again, we live in the same region, so I have experienced these things. So I'm wondering if you all would be able to comment about not just COVID, but also how other things interacted with COVID to impact mental health.
Maybe we start with Leslie, because I know this is like her big wheelhouse.
Okay, so when COVID hit in the spring of 2020, obviously it was not only just a local and national, it was a global problem. And I think there was a lot of uncertainty, like, what is this going to look like? What does this mean? In addition to a lot of fear, there was a lot of, there's medical fear. What is this going to do to our bodies? We're losing people that we love. The masking was a very unusual circumstance for all of us, and getting used to that and putting it on our children. So there was all of that. And then I'll speak a little selfishly for Southwest Louisiana. In August, we were hit with Hurricane Laura, which was incredibly large and devastating. And then 6 weeks later, we were hit with Hurricane Delta. So all of our houses that were already broken were rebroken and broken more. And so as the weather-based trauma stacked, I'll be honest, COVID kind of took a backseat for us. We were a little less worried about wearing a mask when we were just trying to get our houses put back together. So as an overall community, I feel like we did pretty well of helping each other. I'll give one personal example. In my particular neighborhood, we had a Facebook page, and not everybody could get back to their homes, and some homes were more damaged than others, and some were livable and some weren't. But we would post pictures on this Facebook page, and somebody say, hey, check on this street, what's my house look like? And just by posting pictures or saying, hey, I checked on your, checked on your yard, or you needed a tarp on your roof, and we had church members come put a tarp on your roof, just kind of getting each other's back. So I think that when we're in crisis, we get to kind of a primal space where we're not so much about the niceties, like you said, about maybe your hair is not looking cute, maybe you don't smell so great, but you're just getting the basic things done. And that's where you focus. It really narrows down to the things that you must do to survive. And in that, there can be some really beautiful moments of people stepping outside of their own grief and their own loss to help each other and help one another. I remember my neighbor, the first day we rolled in back home with my children, and we had to fix so much of our house, had no electricity or anything. She's like, hey, come to our pool, get water out so you can, flush your toilet, get water out so you can rinse things off. It's just an open buffet, like my home is your home. And I think those kinds of things are really lovely. And in the midst of our grief and panic and fear, we feel that connection to one another, which I think so often is something that we lack, that just connecting to one another on a, we're just trying to get through this together kind of template. So I think that in those moments, we have a choice if we're just going to be angry and bitter about what's going on in the world, or we have a choice to make it better. And I think we always have to vote for making it better. And how can we make it better? And how can we not feel sorry for ourselves? Well, we can do that by helping other people. The minute we take the focus off of ourselves and say, how can I help you? How can I help you? We start to heal, I think. So I feel like that's what my community did a lot of. We fed each other. My God, I think we all gained 20 pounds over the course of hurricane recovery. But that's what we do. We feed each other, we support each other, and we looked for that. And that helped me in my process as well.
I would say from the mental health perspective, I think one of the biggest hits a lot of people took was also not acknowledging how important it was the aspect of connection and seeing individuals I'd also state when COVID first hit, I was at Hopkins and I was working for the Center for Family and Traumatic Stress. And a big reprieve for a lot of my patients and their families was being able to come to an environment every single week where the kids got snacks and the parents got like at least 30 minutes of a break before we did our joint session time. They were able to be in an environment that wasn't as hectic, and they were able to have somewhere that just focused solely on them. And the first thing I thought when they were like, oh yeah, you can take your computers home and everything like that, I was like, my patients, this is one of the few safe places that they have. And by not being able to see them in person, that they were essentially robbed of that, right? So I think that that's the thing that happened with a lot of people. Also, doing therapy sessions with kiddos online is just torture for both of us. At the number of times they just thought I could not see the fact that they were clearly on Roblox is absurd. But it's just like it's obvious. I think we lost you, right? But I think about it that way, and then also the trust. A lot of the trust was severed. I focus on Black mental health and Black identity development and health disparities. And this was another example of during crisis, there is a significant and obvious disparity between individuals who get resources and have access to resources and care and those that do not, right? Which additionally, it's already so hard for people of the global majority of Black people to build and rebuild trust with health professionals and hospitals and stuff like that. And I think that our trust in these institutions took a hit again, right? And it's incredibly difficult because it's hard to convince individuals to see resources and services that I know that will help them. And then they have citation after citation and news article and everything after like, well, this is another place that didn't serve me, right? So I would say that it's another thing that is going to make a lasting impression on how people see healthcare. So I have a concern about that. And also when we talk about times of crisis, I think it's also important to acknowledge that when it comes to health disparities and health inequities, racism severs the safety of every environment. So many people have been living in crisis since they were born on in this land, right? Like we can't acknowledge crises without acknowledging that like there's been a crisis that a lot of people are dealing with. Racism and discrimination severs the safety of any environment. It's effectively like expecting someone to touch radiation without hazmat or to touch it at all. There's no protective aspects of it. So I think and when it comes to health inequities, those are the things that kind of, you say when we talk about intersectionality of identities, it's when we think about the crises, we have to also think about like what it exacerbated. I still have many people who have fear and distrust of the community, of healthcare workers. Even as a healthcare worker, they are just like, I mean, you're okay, but like, unless you have openings, I don't see how that's relevant for me in this moment, right? Like, so I think it exacerbated a lot of things. And I think one of the things we have to work on when it comes to the health inequities are rebuilding the trust. And you can't rebuild trust without acknowledging why it was severed in the first place. And I think that's one of the most difficult things that they don't want to do and that they need to do. Acknowledge the fact that like harm has been caused repeatedly, acknowledge the fact that there are systems in place that constitute these harms, and then acknowledge how we're going to break those down. Because if another crisis happens, God forbid, because COVID is still very much present. If something else happens, the people who are going to be less likely to seek services are the people whose harm have been caused against them, and that's Black people and other people of the global majority, right? So I don't see us being out of it. I know at the airport, no one's wearing masks, and there are people with that identify it as long COVID, but there are individuals that are still significantly struggling, even just education-wise. There's a notable difference in my students' undergrad now than years ago. Like teachers were being expected to do things that were wholly inappropriate. Individuals were trying to survive. A lot of meetings got canceled. A lot of healing got put on hold because people were sick. And I think that we're still dealing with that as well. So just acknowledging that would be incredibly helpful, and think about it in terms of policies. Just like Leslie mentioned, like nobody was thinking about hair. You're thinking about water. We're thinking about what are the repairs are going to look like? We're thinking about that. And then honestly, some places were still expecting 100% productivity. And it's just like, yeah, my child has school for 8 hours and they told me that I got to figure it out. So yeah, this is going to be late. This is going to be late. It's just, it is what it is. And thinking about the hit that that takes to your mental health, having to choose between your child's education or being a caregiver of an adult or being a caregiver of individuals in your home and your job. Like, these are things that people are still struggling with.
Yeah, I mean, I don't know how much I can add on top of these really wonderful comments. Maybe one thing is, Karen, to you like framed this in terms of when we have multiple crises kind of compounding on top, right? So there's like COVID, but then there's also political stressors. There was a in addition, like some people are having climate crises, right? I remember I had just left California at the time, and as soon as they took their masks off for COVID to go outside, they had to put them back on because there were forest fires that were creating an unsafe outside environment for people. The racial justice movement. I mean, there were just so many movements, whether they were kind of progress oriented or just survival oriented. There was so much going on, and we have limits. Like, our bodies have limits and our minds have limits. And if you think about resilience like a container, and we kind of dip into it, right? One crisis we kind of dip in, another crisis we dip in. But when you have crisis mounting after crisis after crisis, people being murdered by the police, it's like, it's just that one last crisis and we scrape the bottom and there's nothing left. And we haven't had the opportunity to replenish in between because of this kind of never-ending onslaught of health-related, environment-related, social-related, politics-related, right? We're kind of being assailed from all angles. And when we hit kind of the bottom of our resources, what do you do? That's when those activities of daily living are getting missed out on. That's when people are feeling kind of helpless and hopeless, wanting to check out, wanting to tune out. And those can be important survival instincts. But then they can also be counterproductive in the long run when people are opting out of community engagements, for example. That could maybe help in the moment. And so it's like, these compounding crises make it more likely that more people are kind of hitting the bottom of the tank, and that makes it really challenging to kind of get through day-to-day life. And having opportunities to replenish that tank can feel few and far between. But I think what Leslie mentioned, these communal moments of connection and opportunity for compassion, for gratitude, for inspiration, for love, at whatever level that feels right, can be one way to fill the tank. But that is just to acknowledge the deeply challenging nature of multiple compounding stressors, especially as they interact on different identities that people might hold, that created the opportunity for them to be hit by multiple stressors at once.
Thanks for saying that. That's just reiterating why I thought we should have this, because it's just multiple crises at the same time, that, just like you said, impacts different people based on their identities. So I really appreciate that. I do want to acknowledge this question that we received. I think I know the answer, but I'm going to let you all respond. It says, and it's asking about healthcare providers, but I think it can apply to many of our listeners are public health providers, or just people who are working in this area. It says, healthcare providers had a lot to deal with during the pandemic. Getting back to having the same lifestyle you had prior to the pandemic has been tough. What advice do you have for this group?
I would say I don't even know if that was the goal, because I mean, I know a lot of people mentioned that, like, pre-pandemic they had certain aspects of functioning, but like, yes, I think it exacerbated some things, but the systems were already always in place that, like, we weren't operating as healthcare workers at the best state in the first place, to be honest. Some of the things that came out of the pandemic was a lot of places went to work, individuals work remotely. But that should have always been in place in the first time, because there's so many times healthcare workers in the first place didn't have to physically, I don't have to chart in the house. I mean, at my desk. Like I should be able to beat my commute and work from home when I'm charting. The aspect of telehealth. Telehealth has always been incredibly prevalent within the military. I worked with the military for a significant amount of time. Telehealth and telesessions were something that were already prevalent, but it was only able to be funded by insurance. And when it came to having more opportunities and providing more resources, even in the education space, for students to be sent home with these devices because of the pandemic. That should have been done already. Like there's so many people who physically, a lot of my patients cannot get out of bed. I have had sessions with my patients laying down, but they were able to like hit the button and have those conversations. So when it comes to that, I feel like it's been helpful with the pandemic, but one of the things I would challenge you to do, and as a clinician, of course, I'm gonna ask the question, like, well, what is the aspect that you really want to get back to? Is it the fact that if you may be struggling that you're not having as much productivity? I want you to ask yourself, was the level of productivity that you were asked to put out, was that appropriate given your life in the first place? Like, oh, I'm not able to get as much done. Can you be honest in stating that you feel like the amount of work that they were asking you to get done was appropriate in the first place? Like, that's one thing. Or, it's incredibly difficult for me to focus, because some people have COVID, like of course you're having difficulty focusing, but also realize, is that only because of the pandemic? Because the same way Leslie mentioned, like a lot of times things come out as anger, low frustration tolerance, difficulty focusing, difficulty staying on task. That's actually a significant indicator that things are going on with you mental health wise in the first place, right? Like one of the ways I know that I'm struggling is that I want to flip a table at the slightest inconvenience, right? Like seriously, some people like they get sleepy, they get more docile. I get mad when I'm stressed out because I'm just like, this is incredibly annoying. I will lose a parking spot and there could be one right next to it. And I'm like, I don't even want to go in this store anymore. Like low frustration tolerance, but a lot of times people talk about, like, oh, I can't focus and I'm having difficulty in conversations and stuff like that. That's not only the aspect of like attention deficit hyperactivity disorder. That's literally the mental health that's under almost every single mental or medical thing in the first place. The difference between that and the diagnosis is having the appropriate person across from you assessing. But like, that's under everything. If someone not being able to focus and having low frustration tolerance, I can give you anxiety, depression, personality disorder, learning disabilities, all of that. So the productivity, I would state, change the goalpost, right? I don't think that should be the goal in the first place. I don't think we should be living for our well-being. And also as healthcare workers, as someone who works a lot with healthcare workers and high achieving people, we take the worst care of ourselves. It's awful. Yeah, like we're bad at it. And I can say this objectively, working with you guys as colleagues and as patients and being a person, we're terrible at it. You don't need more productivity. If you want more self-care and rest, okay. A lot of times people think that they need like 2 hours or 1 hour of self-care in order to be rejuvenative. But if you think it has to be 2 hours or 1 hour, you're not going to use the pockets, right? So you can use 15 minutes and add it up. No, you don't. You may not have an hour, but you may have 4 15-minute nuggets and make use of your time. A lot of people have long commutes. Make use of your commute. It's very hard as someone who focuses on trauma to not bring my work home with me. So I always make it a point when I have really tough sessions to put a stopgap in between walking to the house so I don't bring that in with me. Use your commute, listen to a funny audible, listen to a funny comedy station. I mentioned Pandora the other day. My younger patients didn't know what the heck I'm talking about, but Pandora has comedy stations, and there's nothing better after hearing people talk to you about the worst things that's ever happened to them in their life, having 20 minutes of your commute, listening to someone make you laugh. I don't care if it's a fart joke, chuckle, like create that. And having the difficulty working out as regular, I will tell you as someone who has 2 toddlers that are, destroying my soul daily with their cute little faces, I really make it a point to use those pockets. 20-minute workout is still a workout. And if anything, having the least amount of time makes it so that I don't, scroll during it or, be like, oh, we have an hour, we have 20 minutes. Okay, pick up the weight now, right? Like I just make it a point. And there's a lot of people who have that, like 20-minute workouts, 15-minute HIIT workouts, realizing that I think people feel like it has to be a jog, but really moving your body is helpful in the first place. Like just or bring the kids with you. Like, oh, okay, we're gonna do a 20-minute walk. I don't want to, suck it up. Okay. I didn't want contractions, and yet here you are. All right. So walk with your mother, please. And look up workouts for those specific amount of times. A lot of times people think that you have to have like a Peloton or stuff, but there's plenty of people who do workouts for free on YouTube. And I would just look up 20-minute workout, 15-minute workout, things like that. And move your body and go outside. But it doesn't have to be a jog. Walking and jogging, you're still moving your body, you're still getting outside. I don't know if I want any healthcare worker to go to the other productivity beforehand. I would love for more healthcare workers to get involved in policy, because there are lawyers and there are so many people voting and making laws about how we practice, and they have never stepped foot in a hospital in their life. So I would say the goal is to move the goalpost for productivity. Maybe we need to be on the hill a little bit more, and force everyone who decides what reimbursement rate should be to work in a hospital. Like that would be like, yeah, sure, okay. Yeah, we're gonna reimburse this. I need you to do your shift. I want you to do your 12-hour shift for the next 5 days, and you tell me if that was an appropriate bill to pass, sir. And I say sir because they're always in policy and there aren't enough women. So like just that's not me being biased. That's just, these are facts. These are just stats as someone who, like, ask Dr. Ford, so many men, I'm just saying. But I don't know if the goal should be productivity, because capitalism is the epitome of putting productivity over people. So we're people.
So I'm going to piggyback just a little bit. You said something that made me think about this. I do think we're still getting the reverberations from healthcare workers being tired. I think we have not enough therapists out there. We have not enough nurses out there. I think people have left the field, and all of that is worrisome. But I think the strength in that and the silver lining is that we've learned maybe a little bit better. I feel like the tide is turning. We're learning to advocate for ourselves a little bit more. So like Raquel said, say, no, this is not acceptable. This is too much, or I need a day off. So I see it with our younger generation too, now being solidly in the older generation. I see it with our younger generations that they're advocating for themselves and they're not putting a 60, 70-hour work week as their priority. And I think that may be one of our better gifts that we get out of all of this mess that we've had to deal with, is learning how to prioritize ourselves, prioritize our family, prioritize our personal time. I certainly don't know how it is in Canada, but in America, there's this push to do more, and always be responsive and have your phone on at all times. And I think it's to the detriment of our well-being, so physically and mentally. So maybe just learning how to stand up for ourselves is the silver lining in all of this.
And be okay with the disappointment that will come with that. Because I will always state, in certain scenarios, there's always going to be someone disappointed. You can't, omit that. You need to prioritize not disappointing yourself.
And just to like launch pad off what you both just said, and just go back to gender for just a moment, that there are gender-based expectations around who's gonna be accommodating and who's gonna bend and who's gonna fill in and who's gonna prioritize the team, and that has led to a lot of disparities as well, gender-based disparities, and a lot of that weight being put on women to take extra care during times of stress. And I hope, I'm not aware of any of work being done, but I love the read of the room that there is an increasing prioritization of people on taking care of themselves, even when they're being asked of too much. So I hope that that's true.
I'm gonna come back to what you all were saying, but I wanted to actually go even farther back to something that Leslie said and you all have touched on, is social media. So Leslie, you were talking about Facebook and how that was instrumental during the hurricanes of 2020, but some people, it can be used in positive and negative ways. I think about the exposure to crises through Facebook and how that can be extremely detrimental to mental health. What do you all think about that? And do you have any responses or things that we can do to deal with that?
Yeah, I think that social media is a tool like anything else, right? Like I wouldn't I don't know, use a hammer to put a thumbtack in a wall, you know. It depends. And honestly, if I'm stressed out, it might just be the release that I need. But it's a tool. As someone who I have a million followers across platforms, and I utilize, and I did that all without having to shake a hip or, you know, unbutton the top, you know, not that there's anything wrong with that, but like a lot of times people feel as though you have to like, you got to be one of the coolest people in life to have a good social media. I am a nerd. All right. I read JAMA articles for fun. Okay. Like the social media, when it's done well, is helpful because I'm able to provide individuals with information, mental health information, and resources that they wouldn't have access to in the first place. As a professor, my students have the most access to me. As a scientist, I totally understand that honestly, only my colleagues are reading my articles. But I can use the information that's shared in my research. I can use information from a workshop that I've gone to. I can use one of my talks and blast it online for free that had maybe like 20 different resources or skills that you can use to make it more accessible. Because a lot of the times that I'm doing events and things, they're behind paywalls. Like there are people who can't make it to the American Psychological Association to see all these talks. There are people who can't make it to the latest NIH conference or anything, or even if they could, they're in a different state. When social media is done well, you're able to provide information that people will have access to just with their phone, with just having Wi-Fi. And also it helps to normalize the experience. A lot of times, 5% of psychologists are Black, and that includes men and women. We need new data on non-binary individuals because that needs to be caught up too. But like 5%, there are so many people who don't think psychologists look like me. And just being able to be a psychologist that's like, okay, yeah, they're $20 words, but here's what you need to fix. I'm going to use a $1 word to let you know. Here are signs that there's an issue, and here are resources to help. And here's a third resource just in case you need it. When it's done well, it's great, but it is also a tool. My self-care is also plugging my phone up against in a different area because one, I'm too lazy to get up out of my bed to look at a phone. But two, I also know that it can be detrimental. Me staring at a screen all night, me looking at news that's going to make me hypervigilant, and I won't be able to relax while I sleep. I make it a point to unfollow accounts. I actually mute them first and then see how I feel after, but I'll mute accounts where I notice that my body is more tense when watching them. And then if I notice I feel better after not looking at them, when the mute comes off, because it automatically comes off, I unfollow them. I use it as a way to get more resources. There are plenty of fitness accounts, and I think some of them are amazing. I only follow mom fitness accounts. I only follow mom fitness accounts. I need to hear a child screaming in the background so I can feel like this is a normal experience, right? And there are some people who need something different. They don't want to follow mom fitness accounts. They want to follow other things, but like, it's a tool. You use it the way you use anything else. Pay attention to your body when you are online. If you're looking at accounts and they're making you compare yourself or they're making you feel bad about yourself, why would you ever follow that person, right? And it doesn't mean that there's something wrong with the person. It just means that the way that their content may not be for you. One of the best things that I told one of my patients, and they were like, this is groundbreaking. Acknowledging that everything is not meant for you. So like, it doesn't mean that the person is bad. It doesn't mean that they're not, because some accounts are abhorrent, but it doesn't mean that the person is bad. It could just mean like, oh, I am not your target audience. I'm going to unfollow. And there's no need to announce when you do it because, it's not an airport. You don't have to announce your departure. But like, you can, one of the most helpful things can be curate your content. My algorithm thinks I'm probably like a 92-year-old woman who likes to knit, make pound cakes, and laugh at incredibly inappropriate jokes. Most of those are true, but I curate my content. I put not interested. I mentioned the fact that I don't want to be on there. I put limits on there, and anything that makes me feel like my shoulders are up at my neck or my eyebrows are all the way going down to my nose, I mute it and then I unfollow it and I go from there. But use it for what you need it for. It is an amazing resource. I learned how to crochet online. I can't even read a pattern, but everyone's getting hats for Christmas, right? I learned about resources for free activity for my children to entertain them. It's supposed to entertain them for hours. It works for 10 minutes, but it's still a smooth 10 minutes and they're free, right? Like utilize them for the way it is, but it's not meant to be everything. I know there's a stressor with it, but I think people need to realize it's a tool. Think about it like a hammer. You don't use a hammer for everything. You don't need to use social media for everything.
I completely agree that it's a tool. And I think Dr. Martin highlighted really useful, concrete ways of using it like a tool and saving ourselves from ourselves or saving ourselves from social media. which may be getting a warning label now. I heard on the news this morning. One thing that is different about social media than a tool is the algorithm, right? It's that, you know, the tools in our literal toolbox don't have a multi-billion dollar industry designed around us, you know, going into that toolbox like every single moment that we can spare or not spare, as the case may be. And that's powerful. I just want to acknowledge it, that there are many people and many dollars deeply invested in us staying on those platforms, even when they're harming us. It is a deep challenge, and it takes a lot. And I'm grateful to the strategies Dr. Martin mentioned, because you do have to be so intentional, because everything about those systems are designed to keep you there and to keep you stewing. And we know that people are getting a lot of their news and a lot of their content, a lot of their, like, the way that they're interfacing with the world is coming through social media. And that means it is a conduit of stress. It's a conduit for many other things that can also be, you know, wonderfully, you know, fulfilling and can help us achieve other goals and things we want to do and ways to be healthy. But it's also a major conduit through which we're learning about the world, for better or worse. And so, just want to acknowledge the fact that it can be really hard by design to use it in ways that allow us to be healthy. And it takes a lot of intentionality and hard, deliberate work to keep it as a healthy tool.
I don't really have anything to add. I think you guys all encapsulated it perfectly. Use it in small doses. It's kind of like, you know, a really decadent dessert. You wouldn't want to have it all the time. Have a bite here and there and then put it up. I mean, just like everything that's good and bad for us in moderation, it can be okay, I think. I do worry about our children that see these things and then interpret it as all truth. It's not all true out there, and teaching them and helping them to weed out, you know, the false narratives. It's challenging. I have 2 young adult children, and, you know, I kept the phones out of their hand as long as possible, and they just get into that pretty quickly. So I really think we have to be strong in protecting our children from some of the false truths out there.
I want to ask you all, sort of as the closing question, is there one concrete structural change that you would want to see to address mental health in times of crises? Just one thing from each of you. How about we start with Leslie, then Brett, then Raquel, and then
Ooh, it's a hard question to drill it down to one thing, but I want people to feel empowered to say how they're feeling, say what they need from their support system, ask for support. I want them to feel like it's okay to be vulnerable and say, you know what, today is not a good day for me. I cannot be what you need me to be today. As a matter of fact, I need some support today. So I think we should see that as a vulnerable truth as opposed to a weakness, to say that we need some support. And if people could be comfortable asking for it, I think that would go a long way into helping us get our needs met so we can heal and move forward.
I love that, Leslie. You know, taking off my academic hat and what I study specifically, and putting on just like my human hat. I don't know what a human hat looks like, but I imagine it looks nice. It would be totally in agreement with what the poll said at the beginning, which is paid leave, actually, like a concrete structural change. How are people supposed to do what they need to do when they have to get a pay hit to go to the doctor? Right? Like when they need to kind of do life sometimes happens during business hours and people need to be able to take care of themselves and their loved ones and not have a pay cut for that, because that in many cases people can't afford that, and they're jeopardizing those, or they're sacrificing those things to be able to keep a job. So that's you know, that's not my area of expertise. That's just me as a human, and agreeing with our with my other colleagues and with our, you know, audience here.
Yeah, I would wholeheartedly agree, because a lot of times when people mention the ultimate uh, way that people take the ultimate aspect of dealing with crises is unaliving themselves. And a lot of times people think mental health is the first solution, but it's actually equal pay and appropriate leave, and healthcare, and funding for programs that support unhoused population. But that's not going to be my answer. I would say if there was any way, if we're talking about system policies, I would say that there needs to be a substantial amount of funding for individuals who have a desire to be healthcare and mental health care workers. I think the reason why a lot of people don't go into this field is simply because it's incredibly expensive. I am a licensed clinical psychologist, and it is incredibly expensive for me to get to where I needed to get, both financially and emotionally. So I actually think if there was more money put into programs that would contribute to decreasing health inequities, and one of the things that contribute to health inequities are one, lack of culturally education that practices from a aspect of cultural humility, but another one is lack of racial concordance among clinicians. So if we could create more funding for programs to prioritize individuals getting scholarships to go into these healthcare programs, and not at the detriment of okay, we give you this money and you pay it. We paid for you to go to school for 4 years, so you owe us 15 years in an incredibly difficult work environment, and a community, the fact that we'll fund this to you, and you find a way to provide contributions to your community. So I think there needs to be more funding with individuals in healthcare and mental health care from scholarships. And if some of that money could also go into integrating mental health care within elementary, grade, and high school. Because when I graduated from high school, I can tell you that the difference between a smooth endoplasmic reticulum and a rough one, but I couldn't tell you what to do in signs that I was having a panic attack in undergrad, right? So I think more money needs to be embedded in the healthcare system, because there are so many schools that they have school psychologists, but they're more focused on assessments, and they don't have the time to help the children that are in the environment. And sometimes having the appropriate psychoeducation in middle school and high school can be the difference with individual having a full blown break, and someone able to recognize that they almost need help, and they know to see a clinician, because they learned the signs of major depressive disorder or anxiety or psychosis or panic attacks in middle school, and they learned it in high school, and they know that there's signs when they're having a breakdown or when they're going through a manic episode. So they already know what they need to do to get help. So when we're talking about policies, kids who learned about, children who don't know how to regulate their emotions or help themselves, turn into adults who don't know how to regulate themselves or their emotions or help themselves. And the adults have more resources to harm. So that's typically where that comes from.
Great. All right. Well, thank you all. Thank you to the panelists, the attendees, the people who will watch the recording. Hopefully this was helpful. If you have any additional comments, we are putting a survey in the chat. You can click that survey to provide feedback. We also have additional events coming in the future that you can also see on your screen, including our next webinars and our next workshops, and podcasts are dropping soon. Everyone have a great day. Bye-bye.